Assalamu alaikum and a good day, everyone. My name is Dr. Mohammad Rafi. I am obstetrician and gynecologist from Hospital UMRA, and I'm also the medical director of this hospital. I think earlier you had listened to my wife giving a talk on different parts of pregnancy, and my part is to tell you about the labor process and the delivery. And incidentally, both of us, my wife and I, actually hold an LCP in aesthetic medicine, where we actually do aesthetic gynecology, but that will be another topic. But what aesthetic gynecology encompasses is to improve the function and the beauty of the genital area. And this is normally something that most women will be interested in after a delivery. It's just another one. Let me define labor. Okay. The labor definition is basically very hard physical work, and this somehow has that word has been taken into the process of childbirth. The reason being because we all know when it comes to childbirth, it's a lot of work to be mother. There's a lot of work in the sense of pain, the pushing, and that's why the word labor was definitely something that is very apt in the situation when somebody wants to give birth. And the process is from the onset of labor when the contraction starts, or if there is leaking of the amniotic fluid, right up to the delivery of the baby and the placenta, membranes, and umbilical cord, from the uterus to the vagina to the outside world. Now, one of the biggest issues that most women ask is, Doctor, how will I know when I'm in labor? How do I know if it is false labor? And as a practicing obstetrician over the last almost 30 years, I would tell you something is almost impossible to define. False labor is when you have these occasional contractions that most people start getting anxious. But you do understand there's something known as Braxton Hicks contraction, which occurs from as early as 6 to 7 months of pregnancy. And these are known as practice contractions. So your body is trying to warm up for the actual process of labor. But Braxton Hicks is something that is shouldn't be painful, number one, and it should not be often. So I tell my patients very often that if you have contractions once every 5 minutes, once every 10 minutes, it may be something more serious. But if you're feeling of tightening or contractions once every 3 to 4 hours, usually it's not something to worry about. But having said that, please remember that even at 5 months, you can have a preterm birth, right? Usually, most people deliver after 37 weeks, but at 28 weeks, you can have a preterm birth. And very often, when labor has actually occurred in a preterm situation, the mother thinks this is Braxton and doesn't take next necessary step. Basically, what you need to do is come and see the doctor, let the doctor decide whether you are in labor or not. Believe me, even when people come to me at 7 months and say I'm having frequent contractions, I myself am not able to diagnose whether this is false labor or not. And if we are convinced, we send the patient home. If we're not convinced, sometimes we are forced to keep the patient overnight. Yeah. Now, latent phase of labor, this is a complete different thing altogether. Latent phase of labor is when the beginning part of the labor, you see, you cannot have three intense contractions, which is what is ideal immediately. It starts as once every hour, then becomes once every 30 minutes, once every 10 minutes, and then goes up to the maximum once every 3 minutes. So this frequent tightening that is already, the labor process is already triggered, that can go up to 24 hours, right? This is where they say it's not very painful, it's mild to moderate, it's occurring once every 15 minutes, 20 minutes. And I have this feeling of backache or fullness and period like pains, right? And this stage is actually the longest part of the labor because it can go up to 24 hours. Now, we also have an issue when there's prolonged latent phase of labor. That means this poor woman is having this frequent tightening once every 10 minutes for the last 48 hours, for the last 72 hours. And when there's prolonged latent phase of labor, then as doctors, we are supposed to take some actions, and usually we try to expedite delivery. We try to induce the delivery. Now, the stages of labor is actually very simple. Okay, the first part of the first stage is where there's thinning and dilatation of the cervix. So a thick cervix eventually becomes a thin cervix, and then it starts to dilate up to 10 centimeters. Okay, So during this time, the actual definition of labor is once you've crossed 3 centimeters. So we, as a rule, tell patients, listen, if you're already 3 centimeters dilated, it is 1 centimeter an hour until it reaches 10 centimeters. So we are giving you an approximate 7 to 8 hours. But it may be a little bit longer in the first baby. It may be even shorter in the second, third, and subsequent children. So this is not written in stone. It is not a rule as such. But this is a idea for us to see, is this labor progressing as what we would expect. Now, that first, as per labor is concerned, first stage of labor, a few things that I would like to actually emphasize. People do not understand what goes on. See, very often we have to monitor the heartbeat of the baby, and that is monitored via either listening. That was the old fashion of listening, putting something like the stethoscope that I'm holding here, but it's actually like a funnel. Then we put it on the patient's abdomen and try to hear the fetal heart. This is still being practiced till today. Yes, but it's in places where the CTG is not readily available. CTG is where we do electronic fetal heart monitoring, and preferably if it is done throughout the pregnancy, we are actually very convinced that the baby is safe. When we do intermittent on and off, we switch it off. When there's something going on, we don't normally see it. Okay. The second thing that people need to remember is during this time, the pain, tolerance of pain is different for everyone. Some people say, listen, not so painful, I can handle this. Or some people say, Doctor, I really can't take it. And can I have a cesarean because I can't take the pain? It's a shame to do a cesarean for somebody just because of pain. Now, when regards to pain, we have the easiest is Entonox, laughing gas, right? And that is the one that most people we say try this, but where you just inhale something while the contractions are going on. And when there's no contractions, you stop inhaling. Now, this was and is still very, very popular. It's just that during the last few years, because of COVID, we tried to minimize this. Obviously, everyone who enters the hospital is screened for COVID, but sometimes we are not too sure whether we're missing out, whether we've got some latent COVID going around, the virus is still floating around. So gas is avoided as far as possible. Secondly, we have injections. We have many different kinds of injections. The classical one is something known as pethidine, which is a narcotic, but it is used during labor usually. Very, very, very safe. My mother had pethidine injection when I was born, and I'm 55 years old. So this drug has been around for many, many years. The safety, we are very, very sure. Yes, it makes you a little bit drowsy. It may make your baby a little bit drowsy, but we have the antidote for it, that injection that is actually given to the baby to remove the traces of pethidine in your body so that you're not drowsy anymore, or the baby is not drowsy anymore. And thirdly, we have epidural. Epidural is actually very popular in the West. It is also relatively popular in this part of the world. It's just that because the anesthetist is involved, it incurs some additional costs that sometimes people do think twice about. But it is something that if most people, I would actually encourage, because it makes your labor process completely pain-free or almost completely pain-free. I've known people who have been reading the newspaper while they're in labor. I know people who are playing with the phone and then I'm playing with the games, and they're actually in very strong established labor. It's already 8 centimeters. They don't feel anything. And that is the kind of labor we like to see. Makes it very, very simple for the person. Now, the minute the baby is born, right, this is the second stage of labor. The second stage of labor is from full dilatation right up to the delivery of the baby. This process may take 5 minutes, 10 minutes, it may take up to 1 to 2 hours, right? And sometimes we are forced to use instrumental deliveries. So when we use instrumental deliveries, I mean, in the process that in the event that you cannot push the baby out yourself, then we may need to assist you by using the forceps or the vacuum. People don't like this, but sometimes we are also forced to do this, especially if the heartbeat of the baby is dropping. In fact, just early this morning, at 5 o'clock this morning, I had an emergency cesarean for a lady who was fully dilated for almost 3 hours, and the baby's head was still very, very high. It was not possible to do an instrumental delivery, and we had to do a cesarean section. That will not be a very easy cesarean section, but God willing, it went well, it went smoothly, inshallah. And so it was a happy outcome for both the mother and baby. But I mean, a second stage cesarean section, that means when it's fully dilated, when you can start seeing the baby's hair, we try not to go for a cesarean section because cesarean section can become a difficult process. Third stage of labor. This is the part that everybody is a bit relaxed, except the doctors. Where the mother is happy, she's heard the baby crying, the father is happy, he's taken some pictures of the baby is crying, the baby is moving around, so everybody is happy. But don't forget, until the placenta is completely detached, completely comes out of the uterus, there is still problems that can occur. For example, there can be excessive bleeding and etc. But usually this process takes only between 5 to 15 minutes. And in the event that it takes more than 1 hour, then we need to actually manually remove the placenta. And usually that is a process that's done in the operating theater. So these are the different stages of labor: stage 1, stage 2, stage 3. Stage 1 is from 3 centimeters right up to the 10 centimeters. Stage 2 is from 10 centimeters to the baby coming out completely. And stage 3 is when the placenta comes out. And the fourth stage, which is the happiest moment for the doctor, for the nurses, for the family, is this. Everything is done, everybody is happy. But please remember, you still can have excessive blood loss, right? And that is something that we always must keep in mind. You for the next 24 hours, sometimes people tend to have bleeding. And the second thing that we need to understand is at this stage, vigilance is normally very poor. When you're in the labor room, people are there with you all the time. But in this case, no. But as good doctors, we should be able to be vigilant. And one of the things that patients forget to do is pass urine. They keep the bladder full, and that adds on to the issues of heavy bleeding. Right? Everybody's happy. And this is the time we actually start teaching you how to breastfeed and all that. Because breastfeeding actually helps contract the womb, contract the uterus. So we actually encourage breastfeeding. Now, different birth options. Obviously, there are a few things that I'm going to mention here. One is vaginal birth, which is what everybody is going for. Then there's a scheduled cesarean section. Scheduled cesarean section is for cases that we have already planned. I'm seeing you this week, and I say we do a cesarean next week, and that's usually for breech baby. Baby is upside down, or with the placenta is down there covering the birth canal. So these are ones where we actually schedule a cesarean. Unplanned cesarean, there's only 3 reasons for an unplanned cesarean section during labor: drop in the fetal heart, baby is passing meconium or baby fast motion, and the third one is prolonged labor. You've been in labor for 10 hours, 12 hours, and there's no signs of a delivery. Yes, you need a cesarean section, and that would be considered an emergency cesarean section. This part about the vaginal birth after cesarean section, that means you've had a previous cesarean section, you want a vaginal birth. This itself is a long topic. This itself will take 1 hour. And a lot of people don't understand. My friend had a cesarean and the next time she had a normal birth. So I think it shouldn't be a problem. No, definitely not. There are risks involved. And the biggest, most frightening risk is uterine rupture or rupture of the uterus. And that can be a complete disaster. So if someone is actually planning to have a normal birth after cesarean section, it's best to speak to your obstetrician and get all the issues in place. And normally my style is to actually write things down on a piece of paper and say, go home, read it up on the internet. Going into Google is a good and bad thing. Sometimes people read things and they say, oh, this is nothing. But if you were to actually go to the proper websites and read the risks involved, then you may have to rethink your wishes. Okay, and the last one is the scheduled induction of labor. Scheduled induction means where a patient, she's already 40 weeks or 41 weeks, she's past the due date, and she's still no signs of labor, we induce you. The most popular form of induction of labor is using a drug by the name of prosin, which is inserted in the vagina. Luckily for me, Hospital UMRA, the majority of the doctors are all ladies. I am the medical director and I do not do vaginal examinations except when it's absolutely necessary. So as a rule, we try to keep the childbirth process between a lady doctor and the patient. And my job is to actually maybe explain things to the patient or get involved when there's something not an emergency occurring. If you're bleeding too much, if you need a difficult instrumental delivery, difficult vacuum, difficult faucet, they do call me for assistance, but very often no. So it's one thing about scheduled induction is that's a good thing. Right. Now, other forms of deliveries, okay, I'm not going to go too deep into this. One of it is hydrotherapy, where you actually deliver underwater. But over the years, it's a lot of controversies and it's taken bad, people are getting a bit worried because there has been cases of think about it, right? When you give birth, you will pass motion. When you pass motion, sometimes not everyone, but you will pass motion, and that the feces of the mother is in the water. Baby comes out in the water, so it ends up sometimes swallowing the water that's surrounded with feces. So these are things that I mean, we do get a bit concerned when there's a request for things like this. The next one is hypnobirth. Dr. Umar is actually a certified hypnotherapist and can allow hypnobirthing in this center. But it is a process. This process needs to be started pre-delivery. In the sense, when you are in your pregnancy, we actually start counseling you what to expect. But basically, you don't need a complete hypnobirth. You can actually be counseled in such a way that you will know what to expect and what to do. And that itself is a form of trying to make you relax for your childbirth. But this is something I definitely will not feel comfortable with. I have conducted home birth from sheer no choice. Okay, she's gone into labor, and the husband can see the baby's hair coming out, and they call me, and I run over there and deliver this. But a lot of people actually ask for a home birth in the sense, listen, I'm only 2 centimeters, I want to deliver in my house. This practice a lot in the UK, but honestly, even in a hospital setting, things go wrong. Even in a hospital settings, the heartbeat of the baby drops and you need an emergency cesarean section. Imagine this is happening at birth. Imagine you're bleeding too much. In a hospital setting, we have access to blood. We have access to all the drugs that can actually stop bleeding. We have access to a lot of manpower. At home, at the most, one or two people. It's not something done in Malaysia too much, but in some of the foreign countries it is. And I think it is very scary. Birth plan. Because I'm running out of time, I'm going to quickly run through. A birth plan is basically something where the mother says, I want this, I want that. Very nice to hear and very nice to actually plan. Some of it may be practical, some of it may not be practical. For example, if you were to come to this hospital and say, no male doctors, that would become dangerous because as a rule, there will not be male doctors. But in the event something is happening and I need to do a cesarean section and then the anesthetist is a male, or I'm doing the cesarean section and I'm the male, that becomes a bit dangerous. So when there is a birth plan and somebody says something like this, it is discussed beforehand so that you are at least aware that listen, the male doctor is not going to be in the picture unless absolutely essential. A Malay word or disaster. When disaster occurs, let's not look at gender. When disaster occurs, similarly, some people say, I want exclusive breastfeeding. Now, when you say exclusive breastfeeding, the thing is, I mean, yes, sometimes when you give birth, you have sufficient milk and the baby is not hungry. But sometimes, you just are not producing milk. So what do we do? Can we give the baby formula? And some people say, no, absolutely no formula. Then I'll have to put up a drip. And these things need to be discussed before the baby is born, not when the things are going on. Because you need time to think, can I give the formula? Should I put up the drip? You may have a lot of questions, and we need to answer these questions, and that's where the birth plan comes in. So I do encourage a birth plan all the time. Preparation for mommy, very simple. Your own personal things, your personal toiletries, your personal clothes, but you don't need to bring a lot because usually a normal birth, maximum 2 days. Even a cesarean, maximum 2 nights, right? 3 days. So you don't need too much of clothes. And very often when you're in the hospital, we provide our own clothes. Two, for the baby, basic items, the diapers and clothes for the babies. Again, clothes for the babies. I mean, the hospital has, so we don't need your clothes. We only want your clothes for the time of discharge. When you're going home, you put on your own clothes and take the baby. So really nothing much is needed for the baby. Now, this is another very long topic. We have people who are anti-vaccination, and I will accept anti-vaxxers in this hospital. And the sense once all the counseling is done, we actually talk to them. I personally have vaccinated all my children. I personally will encourage people to vaccinate. But if you don't want to vaccinate, that is your choice. But that part when you don't want to vaccinate, it's the duty of the doctor to counsel beforehand. Yeah, to explain to you what is needed. But one thing that I will not compromise is something known as vitamin K. Right? Vitamin K is not a vaccination. Vitamin K is given to the baby soon after birth, and that is to prevent unwanted or some bleeding within the baby. Baby's bleeding tendency or the blood clotting mechanism is not so good at the time of birth. So if you don't take vitamin K, there is a tendency for the baby to have a bleed even in the brain. And then that's a huge disaster. So please, at least when you say, I don't want vaccination, if the mother says, I don't even want any injections, not even vitamin K, then I say it becomes unsafe. So, like I said, Your safety is my priority. I want a safe delivery. I want a happy mummy, happy baby. At the time of leaving this hospital, mummy must be smiling and baby must be crying. And that is my main priority. If the baby doesn't cry, something is going on. If the baby is crying, fantastic, good news. And that's it. Thank you so much for your time.